Homelessness is a widespread and complicated phenomenon that generally refers to the absence of stable, permanent, and adequate housing. It is commonly related to other intertwined issues such as poverty, health issues, and social isolation. The Department of Housing and Urban Development, CHUD, in the United States, offers a detailed framework for understanding homelessness and how individuals or families may be categorized depending on their housing situation and the potential danger facing them. HUD separates homelessness into 4 basic categories. The first is Category 1, literally homeless, which is described as an individual or family lacking a fixed, regular, and adequate nighttime residence. This includes an individual or a family living in a public or private place not designed for people to live in, such as a car or outside, or someone living in an emergency shelter or transitional housing. This also includes an individual or family being discharged from an institution where they have been a resident for 90 days or less, who were literally homeless immediately prior to entering that institution. Certain demographic groups have been particularly affected. Most dramatically, family homelessness saw the highest single-year increase by 39%. 2023 versus 2024. Nearly 150,000 children were homeless on a single night in 2024, a 33% increase from 2023. Chronic homelessness reached record numbers, with 152,585 individuals defined by HUD as chronically homeless. 1 in 3 of all homeless. Additionally, older adults, 55 plus, are entering homelessness at alarming rates, with a total of over 104,000 individuals aged 55 to 64 experiencing homelessness, and 42,150 over the age of 64, with almost half unsheltered. One exception to these rising trends is veteran homelessness, which continued to decline, producing an 8% drop from 2023 and a 55% decrease since 2009. This result is likely attributed to targeted federal investments and programs. The increase at the national level is largely attributable to declining affordable housing, rising inflation, and stagnant wages.
While there is a significant increase nationally, trends among America's 10 largest cities show a nuanced and often contrasting picture due to local policies and differing urban challenges. Jacksonville surveyed 566 unsheltered individuals in 2024, out of a total of 1,009 experiencing homelessness. The city made a substantial improvement, as its unsheltered population decreased by 49% to 290 people in 2025. The total number of homeless individuals also decreased by 336 compared to 2024. This decrease was attributable to city-funded initiatives and a Florida law that banned public camping and sleeping. The JFRD PATH team was able to connect 438 individuals to shelters and services, and the Homeward Bound program helped 257 individuals return to their hometowns. What is important to note is that 90% of the unhoused individuals engaged by the JFRD PATH team were not originally from Jacksonville. A chronic factor contributing to homelessness in the region is the general lack of affordable housing. Dallas and Collin counties have seen some positive improvements, with a decrease of 12 in homeless counts from 2023 to 2024, and a decrease of 19 from 2021 to 2022-2024. Unhoused homelessness, compared to the total count from 2021, decreased by 24%. With funding from the federally funded Street to Home grant, 257 people transitioned to permanent housing with behavioral health services. There were also decreases in homelessness among specific populations, such as veterans, a 21.37% decline from 2023, families, a 14.9% decline, and youth, a 22% decline. Despite all the efforts and current data suggesting a decrease in homeless counts, the data still reveals an alarming disparity. In Dallas and Collin counties, 57% of the unhoused population are black households, while black households represent only 19% of the overall population. San Diego, California. There were 2 total homeless person population point-in-time PIT counts. There was a general PIT homeless person population count increase from the previous year's PIT count, from a total count of 10,206 spring 2023 PIT to 10,605 in the fall 2024 report. However, the actual preliminary reports from the RI 2025 PIT count reported a 7% decrease with a total count of 9,905, of which 5,714 were unsheltered, compared to the aggregated counts from the first year. The city of San Diego is reporting that the PT count homeless person population has dropped again, down 14%. The overall unsheltered homeless veteran count was significantly lower than the actual unsheltered counts reported in the PT count year. This is because the total homeless veteran population was reported to have declined by 25% from 2023 to 2024. Counts of the PIT population did not show an actual numeric decline when sourced from day counts and total counts for individuals experiencing homelessness. While fewer individuals were being counted overall, there was an increase in the number of older adults, 55 years and older, entering homelessness for the first time. Additionally, the total count of individuals living in vehicles, vehicle dwellers, increased by 7%. Advocates and total count documentation also confirmed this observed increase. During fiscal year 2024, San Antonio saw an overall increase of the homeless population of 6.8% to 3,372 people. This makes San Antonio now the second largest homeless population in Texas, surpassing Houston, Austin, and Fort Worth. The sheltered homeless population also increased by 8.9%, while unsheltered homelessness saw a slight increase of 1.6% to 888 people. The number of chronically homeless also increased by 35%. Families with children requesting assistance increased by 11% to 611 families served in fiscal year 2024, a 17% increase from the previous fiscal year. Overall, despite the increases, the percentage of homeless to the total population of Bexar County increased only by 0.01%, and the unsheltered homeless population declined by 25% in comparison to 5 years earlier. The rise is largely attributable to a myriad of economic reasons: a lack of affordable housing, rising housing costs, the end of eviction moratoriums, and a decrease in federal funding. Philadelphia reported 4,215 people in various city shelters and transitional housing, and 976 were unsheltered in 2024, for a total of around 5,191 people staying in these situations. Between 2023 and 2024, the number of unsheltered individuals in the city increased by 38%, and the increment from 2020 to 2024 shows a 16% increase. In Center City alone, there has been a 23% increase in unsheltered individuals living in public spaces. Areas beyond the edges of Center City showed an increased percentage of 44%. Philadelphia's count showed that the rate of homelessness decreased by 8% leading into the early 2020s, largely due to various pandemic-related supports. However, the rate has steadily increased since and is now close to pre-pandemic levels. Philadelphia has the highest poverty rate of any of the 10 largest population cities in the United States. Economic instability, lack of affordable housing, mental health disorders, and substance use have all been identified as critical contributing factors. A rough estimate indicates that 22% of the city's identified homeless population is considered chronically homeless. Arizona's homeless population grew 3% to a total of 14,737 individuals in 2024, although unsheltered numbers statewide decreased by 4%. The total homeless population in the city of Phoenix decreased slightly, less than 1%, from 6,902 in 2023 to 6,816 in 2024. This included an uncharacteristic 19% decrease from 3,333 to 2,701 in the number of unsheltered individuals in Phoenix, while the materially sheltered population increased to 4,115 persons, a 15% increase from 3,569. The decline in unsheltered homelessness and increase in sheltered homelessness is attributed to Phoenix's investment in shelter capacity. However, Maricopa County, including Phoenix, has increased its total homeless population from 6,614 in 2019 to 9,435 in 2024. Increasing housing costs, a record high number of evictions, and lack of supportive services continue to be significant issues. Additionally, Maricopa County had an overall gender gap, where 72% of the unsheltered people experiencing homelessness are men, while in the sheltered environment, men represent 57% of the total population. Also, Black populations, as well as American Indian and Alaska Native populations, are overly represented in both sheltered and unsheltered populations. Houston continues to make substantial progress in tackling homelessness, with an overall decline of more than 60% since 2011 and a decline overall of 17% since 2020. The 2024 Homeless Count and Survey estimated 3,280 individuals experiencing homelessness in the area of Houston, which was an increase of 0.3% or 8 individuals from 2023. In 2024, 66% of the homeless population was sheltered and 34% unsheltered. Over the last 4 years, unsheltered homelessness has decreased by 33%. The cause of 50% of homelessness within the region indicated that economic crises such as job loss or expenses exceeding income were the cause of homelessness, thus greatly disproving the overused stereotypes related to substance use, which makes up less than 10% of homelessness in the region. There were racial disparities. Black or African American persons made up 62% of the total homeless population, and men's share of the unsheltered homeless population was 78%. Illinois is seeing a troubling increase in homelessness, with an increase of a shocking 116% as of early 2024. While other reports of homelessness in Illinois exist, much of this was reported in Chicago. Chicago's PIT count reported about 18,836 experiencing homelessness in 2024, outweighing the previous PIT count of 6,139, marking an increase of over 200%. 91% of the increases, both in Illinois and the city of Chicago, were due to the influx of migrants and asylum seekers. The budget dedicated to homeless services in 2023 was $17 million. Only a year later, in 2024, the city needed to allocate $12.5 million and will likely need more to emergency homeless serving costs. Moreover, if we adopt a broader definition of homelessness, which includes doubled up individuals or couch surfers, The Chicago Coalition for the Homeless estimated that about 76,375 Chicagoans experienced homelessness in Illinois before 2024. The pit count required by the federal government to understand the state of homelessness offers a narrower definition of homelessness, which the Chicago Coalition for the Homeless has reported is not likely to accurately count homelessness. Most importantly, affordable housing and wages that are affordable to work for remain among the core conditions that underlie homelessness. In 2024, Los Angeles County has reported there are 75,312 experiencing homelessness, which is an infinitesimal 0.27% plateau and or small decrease in those experiencing homelessness compared to the previous year. Good data suggests there has been a 5 to 10% reduction in unsheltered homelessness overall in Los Angeles County, with 10% in the city of Los Angeles and 5% in the county overall. However, let's keep this in perspective. California had a total of 187,000 in 2024, 24% of the country's total, and of those, 2 out of 3 experiencing homelessness were unsheltered. Homelessness in California increased by 3% from 2023 to 2024, but still at a slower rate of increase than the country. Economic hardship was identified as the cause of homelessness again by 68% of the newly unsheltered in LA County. Eviction filings in LA County went up another 38% in 2022 to 2023, once again emphasizing the affordable housing threshold, with continuing housing cost backlogs that continue to factor into California's homelessness and housing costs of living. A household of 4 needs just over $102,000 annually to afford a basic 2-bedroom apartment. It should be noted there are questions about the validity of the 2024 PIT count in Los Angeles, with concerns raised about data collection and exclusions of counts.
New York City registered the highest per capita homeless rate in the nation in 2024, 81 homeless per 10,000 residents. The homeless population in the city was 140,134 in 2024, a significant leap from 88,025 a year earlier. The homeless in New York increased the state's homelessness by an astounding 53% from 2023 to 2024, making New York the second highest state for overall homeless population, behind California. An inciting factor to this rise, particularly in sheltered homelessness, has been refugees, asylees, and migrants. 88% of the increase in sheltered homelessness was due to the influx of migrants, with nearly 60,000 in the city as of January 2025, and asylees peaking at approximately 68,000 in the city in January 2024.
For family homelessness in the DHS family shelters, it averaged 19,148 families in 2024, which was a 17% increase from 2023, affecting over 32,800 children. And although New York City has high homelessness rates, its unsheltered homelessness rate, 4.4% in 2019, is one of the lowest in the nation because it has a right to shelter mandate.